Alrighty, so hello everyone. Welcome to the Gout Support Group of America's webinar this evening. My name is Stephanie, and I'd like to start by thanking our panelists and participants for joining us today as we discuss Giving Gout Away, the guide to managing gout around the holidays. Over the next hour, we will learn valuable information from our guest speakers. We will also have time for Q&A, so please be sure to submit your questions in the Q&A box, or if you're watching our Facebook Live, please submit your questions in the comments section. Before we get started, I'd like to introduce our guest speakers for tonight, GSGA's co-founders Dr. Parker and Gary Ho, as well as Dr. Larry Edwards of Gout Education Society. I'll let each of them tell you a little bit about themselves. Dr. Parker, I'll hand it to you first.
Sure. Well, I'm a clinical rheumatologist in Austin, Texas. I did academic rheumatology when I was in the Army and left the Army in 2003 and been a community-based rheumatologist ever since.
Great.
Awesome,
I'll
thanks.
jump in. Thanks, Chris. Gary Ho. I am the co-founder of the Gout Support Group America. I had lived with gout since I was the tender age of 24 years old in 1994. And it's been quite the journey up to this point, but I am really happy to say no flares, right? Everything's been managed successfully since 2010. And so we're actually all hoping to be able to pass on some words of wisdom. We believe that managing gout and living pain-free is completely doable with gout.
Absolutely. I'm Dr. Larry Edwards. I'm a professor of medicine at the University of Florida, where I've been for the last 42 years. I'm also the vice chairman of the Department of Medicine and have been involved in gout research for about 45 years. And it's a delight to be here with both of you and you, Stephanie.
Thank you, Dr.
Thank you
Edwards.
for joining us.
Mm.
And I'm going to actually start with you. So, why is it important to avoid overindulging in alcohol and food? Why is moderation of common flare-inducing foods important? What kind of foods over the holidays should those with gout be on the lookout for?
Complex topic that the whole concept of food and alcohol and overindulgence is part of the mythology around gout, that a lot of people believe that their gout is caused by food. That's simply not true. Uh, Certainly, people can flare with certain foods. Typically, we talk about red meat, shellfish, um, beer, as particularly beer as a alcoholic beverage. But the disease isn't really caused by overindulgences or any of these substances. It's a genetic disease. It's a metabolic disease, and it's made worse by people that are obese. A lot of the defects in the way the body eliminates uric acid from it um, is caused by genetic defects, and that's the underlying basis of it. Um, but most people with gout will tell you that they connect a certain food type, and not everybody has a food reaction as far as their gout's concerned. Probably about half or 40% can tell you that, yeah, if I just eat a handful of shrimp, I'm doomed the next morning or the morning after that. If I have a couple beers, I'm can expect to be paid for that. Okay, but again, this is just increasing the flares, and it's something to think about. The more important thing has to do with what a kind of a diet should somebody with gout be on. It used to be that we really pushed hard on these low purine diets, so that these foodstuffs that I talked about were simply eliminated. And I think that's too drastic a move. People with gout can have a beer each night. They can, by and large, have a steak every now and then. It's the overdoing it that causes problems. And the diets that we recommend in the Gout Education Society are the DASH diet, which is one that's commonly given to people with high blood pressure, and a Mediterranean diet, which essentially is grains and nuts and green vegetables and little chickens thrown in on the side. But they're just kind of common sense diets that people with gout have because most people with gout have other medical problems, high blood pressure, kidney disease, maybe some heart disease, diabetes. All of these are more importantly handled by diet than gout itself. So it is important to watch what you eat for all of those reasons, and especially around the holidays when we all tend to go a little bit crazy with food. So just moderation in everything. And that's what I tell my patients. I'm not asking them to give up beer. I'm not asking them to give up meat or shellfish. I'm just saying do it in moderation.
Mm.
That sounds good. Thank you so much.
Mhm.
And Dr. Parker, can you provide an overview of urate lowering therapies? What are they and how do they play a role in managing gout?
Sure. As I transition to medicines, I'm going to follow up on Dr. Edwards' very practical and pragmatic advice in that regard. And I'll also say that it's very common for me to have a discussion with diet. And I advocate the exact same things that Dr. Edwards does. And I really try hard to get the patient and the family members to stop beating themselves up when they flare. This is a common thing that I see. And so just like Dr. Edwards said, I say, listen, you want to have a common sense diet and trying to eliminate or put X's on all alcohol and all shellfish and all this, that, and the other thing is completely not doable for anybody. And I remind patients that I have Olympic athletes in my clinic, professional athletes, these are disciplined people. And if I said, you don't do any of that, they would look at me like I'm crazy, which I would be if I told them to not do those things. No one can do that. So just thinking this is a genetic illness with lots of other things going on, have a good diet. Eat your vegetables, eat your fruit. And then I can help you with medicines. That's my segue, Stephanie, to your question. I can help you with medicines to assure you always have that uric acid under control. And so to think your gout is controlled because you're not flaring, wrong, bad idea. You don't know anything. If all you know is you're not flaring, you need to know, just like a diabetic needs to know what their sugar is. If you have gout, you need to know what your blood uric acid level is. I can help you with that with medicines, right? So you're doing your diet, and I have pills that are generally one pill once a day. And I can adjust the dose as I say. I can titrate, or I look at it like I'm cooking. I have all these spices and I'll do a little of this, that, and the other thing to keep that uric acid in a target range. So in Texas, we all have guns and they understand a target and a bullseye. And so I say, listen, I'm going to put the target right here and I want you between 2 and 6, right? I give them a number, clear visual of what we're trying to achieve. And the better you are at diet, not fudging it, yeah, the easier I'll have with using pills. Common medicines, the most common throughout the land, allopurinol, not just the United States, but the world. One pill once a day, inexpensive, tried and true, been around for decades, beautiful safety profile. Now, there's no one size fits all. If for some reason you didn't tolerate that medicine or was ineffective, yes, I have other pills. Uloric or febuxostat would be another one. Again, it's a pill once a day. I have to adjust the dose to achieve that bullseye that I mentioned earlier. Rarely will doctors throughout the land use probenecid, but this one works differently. It helps our kidneys excrete more um, uric acid. And that one is not one pill once a day. So it's got a hassle factor associated with it, but it's inexpensive. And all these meds that I've mentioned so far are generic. And there's always some people, some unlucky people that have very bad um, illness, whether it's gout or something else. And some people need not pills, but temporary periodic IV medicine that really lowers uric acid down. And as I call it, clean house. This one's called Cristexa. Clean house, get that uric acid down, really clean up the house. Then I transition you to pills shortly thereafter. Usually it's a matter of months later, and then they're on their pill, and that's how I get people's uric acid down. I'm checking the labs along the way. I'm not depending on
Mhm.
how often you're flaring to really allow me to know.
Thank you for the overview. And
Sure.
Dr. Edwards, to build on this, can you talk about missed doses of ULTs and why
Hmm.
is adherence to ULTs important?
Yeah, so as Chris was saying, the whole problem with gout is the accumulation of monosodium urate crystals, uric acid crystals around the joints. And as long as you have these crystals, they're the triggers for the flares, for the joint destruction, for the chronic arthritis if left untreated for a long period of time. And so what you're trying to do with the drugs that Chris mentioned is to get the uric acid level down to a low enough place that instead of uric acid coming out of solution and crystallizing, it'll do the reverse thing. The crystals will dissolve and go back into the serum, and you'll urinate them out. And that's the whole ticket. The urate lowering therapies that are oral, the allopurinol and the febuxostat predominantly, are important in that they can lower the uric acid level down to less than 6 is our target zone, and my personal one is actually less than 5. Um, and when we do that, then the uric acid level stays nice and calm. What causes a flare is for a dramatic change in uric acid levels in the serum, either a dramatic rise that you might have if you decide to go out and do a 6 pack of beer this evening, that your uric acid will go up, and that's what triggers that problem. Or if you have all you can eat shrimp down at your local place, it causes uric acid to go up. The other side of the coin is that if you do something dramatically like put you on a very high dose of one of these urate lowering therapies, is it drops down. So either one of those things kind of destabilizes these cluster of crystals around the joint, and it triggers the flare. So yeah, not missing one of your daily doses of either allopurinol or febuxostat is important, because then going back on it will cause your significant variation in your uric acid level. Uh, Taking a particular medication, most people, like I mentioned before, with gout have other metabolic diseases that they're on a blood pressure medicine for, or maybe some sort of heart control medicines. And the uric acid lowering therapy should be right there with your other medicines, and you shouldn't be losing it, or you shouldn't be missing the dose of it.
Thank you, Dr. Edwards.
I'm going to chime in
Gary,
one thing, Stephanie, on that.
sure.
Agree with everything, but I will say that as a fellow Earthling who takes medicines, if I do accidentally forget to take my pill, I realize it later and I just go, oh, darn, should I take two and catch up or just start over, tomorrow? And I would say you don't have to take two to catch up for reasons that Dr. Edwards just shared. That's going to make the delta from high to low even more. So I'll just say, listen, if you missed one tomorrow, you just take it again. Try to put it next to your toothbrush if you're a person who brushes your teeth, that is, so that it becomes like autopilot types of things that you rarely miss it. And then that kind of consistency will transition into number one, no cavities if you're brushing your teeth, and number two, no gout flares eventually.
I hope everybody on this webinar brushes their teeth. I'm sure they do. But that's actually a very good idea to remember to take any medicines you need. Gary, would you mind jumping in on the patient perspective here, especially as someone who has successfully lived without a flare-up in years?
Yes. So first off, I just want to say how thrilled I am this evening. We're with two of my favorite doctors here,
Hmm.
Dr. Christopher Parker, Dr. Edwards. Combined, the two of them have, I think, over 70 years, of just working with gout. And so we are lucky to have the both of you this evening.
I'm
And
honored too. Dr. Edwards is one of my mentors, so I echo that thrill.
Good to be with the both of
absolutely.
you.
Yeah, I'm so excited. For myself, gout is is real, right? I experienced my first attack, and some of you might know this, in 1994. I was 24 years old. I was pretty young, right? Very active. And then just out of the blue, this tremendous pain came on. It was overwhelming. It happened, in the evening. It affected my ankle, and I went and tried to get some help right away. After speaking with my dad, I found out that gout actually runs in my family, and so I took that knowledge to my physician. But back then, he listened to me, but then kind of dismissed it. I was happy though that he dismissed it because, in my mind, when he said I didn't have gout, I was thrilled. I don't have gout. I'm way too young to have gout. Well, basically, I did have gout, and with time, that relief and that joy vanished because gout is what I've learned. It's intermittent. So even though I don't feel pain at with some days, the condition is with me forever. There's no cure for gout. So for myself, it took about 16 years before I was able to receive a diagnosis. And I think many who are listening to this would probably identify with that experience. When you don't have a diagnosis, your option for managing gout is limited. And so for me, it became turning to over-the-counter options, specifically anti-inflammatory medications that you can buy from any drugstore. And I started consuming them like candy when the flares would come. And so I was basically managing the symptom or the pain, but never the cause of gout. So the problem never vanished. It actually became worse with time. And as I learned that if you let gout go unmanaged over years, it actually becomes a toll on your body, which it was with me. I developed tophi, which basically, in layman's terms, they're knots, right? They're little crystals that start forming around the joints, and given enough time, they become bigger and bigger. And so some of you might notice some lumps, right? Maybe around the big toe, maybe around the elbow. You'll see it start forming. Sometimes it's painful, sometimes it's not. But when the tophus is there, it doesn't go away. It actually continues to grow. And there's no way to manage this. There's no way to get rid of it. You can only manage the pain. Um, and so that was really debilitating. It affected me physically, Stephanie. It affected me mentally too. A lot of people don't realize that when you live with gout and you're suffering and you're living in pain, there's a certain stigma that comes with gout that I don't think any other disease has. And so it affected my mental stability. My mental health suffered a lot. Being young and suffering from uncontrolled gout. I mean, can you imagine? I should be active, out there living the best life at 24, at 30. I didn't receive a diagnosis until I was 40 years old. I lost half of my 20s, all of my 30s, before I was able to receive that diagnosis. And so I would say that gout, if left unmanaged, is destructive. So don't be guided by feelings and how your body feels, in the sense that if you don't feel pain, you think you don't have gout. That's one of the biggest misconceptions, I think, of of the gout community. Even if you do not feel pain, if you have gout, it's there, my friend. If you're not pushing forward, it's pushing back on you. There's never a pause. In this game of life with gout, there's no pauses. And so I think the biggest thing that I can really put on the table right now as a patient living with gout for those within our community is, first and foremost, if you do not have a diagnosis and you think you have gout, please go find your voice, find the courage, and go see a doctor. And then once you see a doctor, that's only the first step. The second step is that you really need to push for a diagnosis. If you think that doctor is not understanding what you are experiencing, what you've been through, they're not hearing what you are feeling and whatnot, it's okay to seek a second opinion, right? It's okay to seek a second opinion. And don't beat yourself up if you have gout. It's not your fault. There are many reasons why people enter into the gout club, right? As I call it. Um, but once you're in here, there's a lot of help. There's a lot of tools, as Chris would say, Dr. Parker would say, there's many tools in the toolbox. I remember him telling me that vividly when I first met him. And that gave me hope, and it should give you in our community hope. Because if there's a will, there's a way. With gout, there's always a way. So find the will.
Thank you for that. And speaking of tools in the tool belt, Dr. Edwards, we often hear about a pill in the pocket approach. Can you share why it's important to keep ULT and anti-inflammatory prescriptions on hand, especially if one is traveling?
Sure. The therapies for a gout flare are different than the medicines, the uric acid lowering therapies that we've been talking about, the allopurinol and febuxostat. But for the acute flares, the options come down to the non-steroidal anti-inflammatory drugs, like you can get over the counter, Aleve, Advil, naproxen. Those are helpful. Corticosteroids are frequently used by physicians for these flares as well. Prednisone, Medrol are the names that you might recognize for this. And a prescription drug also that's more specific for gout type of pain is called colchicine. It literally has been around for 3,000 years, but in pill form, of course, just from the 1950s here. But those drugs are all about equally effective in slowing down the flare and eliminating the pain. The important thing to know about them is that although they're equally effective, they're most effective if you start them as soon after the onset of flare as possible. So most people that have had gout before get this kind of aura almost before they start developing the symptoms, that they know something's coming on.
Mhm.
And if you start taking one of these medications or a combination of those medications, um, you know, at the onset of the pain or within the first 7 or 8 hours of having the pain, then the symptoms tend not to be the long, arduous 5, 7, 10 days of pain. You might cut it down to where they only might have a half a day of pain, and things are really coming under control. So the important thing is, even going off to work, if you have one of these types of medications, these anti-inflammatory medications with you, you can start taking the initial doses of it, right away, and then you can continue that when they get home. The important thing is when you go on a trip is to make sure that you pack all of those with you. And that also goes for the urate lowering therapy for reasons we mentioned before. You don't want to have big gaps between the last time you took an allopurinol and the next time you take it. And so, making sure that you're packing those along with you is quite important to prevent increased flares. So the effectiveness of the anti-inflammatories and the continuation of uric acid lowering therapy is important. Let me just say one thing about what Gary was saying about stigma. That this is a real thing. We've actually completed a study just in the past year looking at the perception and bias that physicians have towards people with gout, and it's a unfortunate but real thing. It's similar to the bias that that general public has and physicians have with general obesity, but it's actually more ingrained because here they're thinking that because of somebody's overindulgence, that's the reason that they have this disease, and now they're coming to me for treatment. It's simply not the case, and the more we can do to dispel those falsehoods, the better off the gout population will be.
Mm.
Yeah,
Thank
thank
you.
you for that, Dr. Edwards. And I'm going to kind of use that to say something that I want our listeners to really pay attention to. And that is there's lots of doctors, because of their bias or not, I don't know, but many don't think ahead about giving you medicine for a potential flare-up before it happens. This pill in the pocket idea is exquisitely important that Dr. Edwards mentioned that it's easier to, as I say, put out a fire before it's a bonfire. It's easy to understand like that. And so if you're seeing your doctor for gout management, you're talking about uric acid and all that stuff, great. But you know, and they know a flare up could happen, could be on a weekend, could be on a holiday, could be whatever. If they don't offer you something to take for a flare up, ask. Just say, Doc, if I have a flare up, what do you want me to take? Can I get that now? Because the longer you wait, hours can get you from I can't walk to this hurts to I can't walk. Hours. So get that at home, especially during the holidays. A lot of doctors are going to be closed from Christmas to New Year's and all that. You're going to have a tough time if you're not supposed to be taking Advil because you have sick kidneys, as Dr. Edwards mentioned earlier, or something like that. Be proactive. Have it now. None of these medicines that we've mentioned for flare-ups are expensive. None.
I love that. Thank you, Chris. As a person living with gout, I gotta tell you, I have my Fabuostat next to my bed, right? It's my daily regimen, like clockwork. I wake up, yawn, stretch, reach over for my medicine, and
Mm,
take it. I pop it, right? And so, Dr. Edwards, you were talking about how you love to see your patient's uric acid level below 5.
mm,
I think Chris's approach is the same, right? And so with him working with me, I know where my uric acid level is constantly, whether I go to Chris and get my blood work done through his office, or I use a kit, an at-home kit, just like a diabetic would test their blood. I do the same thing at home. And so I know where my levels are at all the time. Some might ask, well, how accurate are those test kits? Well, maybe not as accurate as going to the office, but consistency is key. And if you're using the same tool
mm,
constantly, you kind of have that benchmarking, you know where you're at,
mm,
right? And so for myself, I know that I'm south. I'm below 4, probably hovering around the 3.7 consistently. Is that too low? No, not for me.
on the
Not
bullseye.
even close. Right. I think the lower the better. And honestly, I would say that if you can get it way below 6, that's just more wiggle room for you to live your life because we're not perfect with our diet. And remember, it's not the diet, it's your body's inability to get rid of uric acid, and it's your body's ability to overproduce uric acid. So we have this double whammy that we're living with. And so if I can just constantly keep my uric acid level low, then I know that I just last week when I consumed that delicious turkey that my brother-in-law prepared with all the fixings, and I went for seconds, I wasn't sweating at all. I knew that my levels were going to be way below 6. Now
That's one
I'm
of the
always,
That's one of the great components of having your disease under control
Yeah.
is after a while, all of the crystals around your body have dissolved and you no longer have the matches to set the fire to begin with. And so it's
Mhm.
you're free to go on as long as you keep the uric acid at a low level.
That's right. And
And I
so you,
encourage everybody with gout to know what their serum uric acid level is and not to be satisfied until it's down in this lower range that we talked about.
right. That's
Well
so
said.
key. That's so key. Knowing where your uric acid level is key. That's part of being proactive with living with gout.
Mhm.
It's not being reactive to where you wait until the next fire comes and consumes your home, right? And you pull out the extinguisher. You're not waiting for the next attack to grab your pain medicine. That's not how you want to live life. Um, that be said, I will tell you, I also have anti-inflammatory medication that's sitting right there. Though I haven't touched it since 2010, I'm a Boy Scout. I've learned I'm always prepared. So I have it there with me. That is a good lesson as we enter into the holidays, right? Like we're talking about right now. We need to be prepared. You need to have tools that will lower and keep your uric acid level low on one end. On the other side of gout, you have to also think about the pain factor and the flaring. Those are two different tracks that we're talking about for gout. So if you're going to flare and if you think you're about to flare, the allopurinol will not put that fire or the pain away. It's just going to lower your uric acid level. You'll need to have tools there to prepare yourself for that intense pain that we all know and we all can feel that might be coming down the track,
Mhm.
the flares. So be prepared for the holidays.
Thank you. Speaking of being prepared, Dr. Parker, could you address some common mistakes and myths surrounding gout management? What misconceptions do you think are most important to address, and how can people avoid these pitfalls?
Sure. Let me go through them kind of in the order in which I think they can occur in somebody's journey. First, at the very beginning, if they know they have gout, most people show up in my office thinking, oh, I can fix this with diet alone. Wrong. That's not true. Regarding other myths that Dr. Edwards and Gary mentioned, if you're a person with gout, many people, even sometimes themselves, think, oh, I did this to myself. This was my fault. I drank beer, I ate shrimp or whatever. No, Dr. Edwards already mentioned genetic background. There's lots of other things that have to happen before you join the club, as Gary says. Then, once therapy is implemented, meaning say you're on allopurinol or febuxostat or some pill to help you control uric acid, and you're being moderate with your diet, and people start thinking, oh, I couldn't flare now. That's not possible. When in fact, you could flare even if your uric acid is in that target range until all those crystals are gone, like Dr. Edwards just said, right? When those are depleted, now you're really protected. But until that occurs, you could flare. So you have to have your flare medicine ready to go. Next, and this is one of the most common I see the doctors say, this is their mistake. They'll say, "Oh, if you have a flare up with your gout, stop taking your allopurinol, take your anti-inflammatory. When the flare-up's gone, restart your allopurinol." And as Dr. Edwards just mentioned, it's those fluctuations that get people into trouble. So you don't need to be stopping and starting your medicines right now, right? You still want to get to that consistency, right? So don't do that, right? Don't do that. Um, I think those are the big ones. The
Yeah,
last
that
thing
is
I'll
a
say
very
on
common, that's a very common mistake that
very common.
all sorts of health
Oh,
practitioners push,
exactly.
and
Yeah.
it's just exactly the wrong thing to do. Once you get started on a urate lowering therapy like allopurinol or febuxostat,
Hmm.
you're on it.
You're on it.
There's no reason that even the surgeons can come up with. They might be taking it as surgery, but they don't need to stop that medicine for anything. So, yeah,
That's
don't
a huge one.
stop
Yeah.
it
Thank you
for
for
that.
amplifying that. There's just
Yeah.
no good reason to stop the medicine. And then I think last, in terms of myths that I'll cover that are very, very common, is I realize that there's all kinds of anecdotes about things they could put in their diet to help. People want to have cherry juice and turmeric and sleep under a pyramid and swirl around some crystals and all these things. And I say, fine, go ahead. But those things by themselves are not going to be adequate to control that uric acid consistently, durably, and keep it in that target range unless you have some medicine help, because you can't replace your genetics, as Dr. Edwards said more than once. There's genetic stuff at play here, and you can't control that, right? So advised, the cherry juice and all those things are not going to get you where you want to be by themselves.
I know we see a lot of cherry juice discussion in our Facebook groups, and that's a very common question we receive. Gary, could you share a personal experience from the early days of managing your gout, maybe a challenge you faced or a misstep that taught you valuable lessons others might benefit from?
Yes. Just thinking back on my experience, some lessons. First and foremost, I do want to touch on the diet factor. Diet is good. It's a good thing to focus on, right? We all should be eating healthy and wanting the best, right? The body's our temple. We want to take care of our temple. We also want to splurge every now and then, and that's fine. Everything in moderation is fine. Just remember, if you have gout, it's your body's inability to get rid of certain chemicals, and we'll just, uric acid, and that's the factor. In my early days, because I didn't know any better, I did turn to cherries. I did eat a lot of yams and citrus, and you name it. Everything that is being discussed within our support group, the Gout Support Group of America, I've done. Was it bad for my body? No. Was it good? Who doesn't like cherries, right? I can eat cherries every day. That's fine, you know. But to focus on that alone as the magic silver bullet that's gonna put down gout was was a road that I should not have been on, at all. It actually it wasted a lot of time, resources too, right? It's not cheap for some of these supplements that are out there.
Mm.
And you can't I don't blame the our community, because I know when you're in pain and you're suffering, you want hope. I get it. Because I've been there. I was looking for hope. Um, all I can say is this. I'm not saying to get rid of that stuff. By all means, if you want to take supplements, that's great. I mean, I take supplements now for vitamins and stuff that I think that I'm missing, right? I'll take it. That's fine. That's great. But I know I've been through enough now with gout to where I know that nothing will be as effective as the medicines that are available specifically to lower that uric acid level. That is the key. And take the supplements and eat healthy and all that in conjunction with, right? That's the key. Like, get it through your mind in conjunction with the relationship that you have with your gout specialist and your medication and your dosage. That all should be incorporated into our lifestyles as people that are in this gout club of ours. Um, and the second, I think, fear is, and learning point for me would be the fear of being known as a pill popper or somebody that is dependent on medication. Who wants to be known as that? At 24, at 30, who wants to be known as a guy that has to wake up every day and take a pill for the rest of my life? Who wants to be? Nobody wants to be there. But it was actually a relief and freedom that I experienced once I accepted that reality.
Mm,
It's okay. It's funny that when I have a headache, I don't think twice about grabbing an aspirin and taking it. And that analogy is true because when we're sick in other places, we don't have a problem. But when it comes to gout, for some reason, and there's a big club of people or group of people that have this mindset, I don't want to take pills every day. I don't want to be reliant on a drug. Well, what if I were to tell you you're missing some things that within your body and you need this medicine to even you out and to make you whole? What would you say if I said that? That's kind of how I had to start revamping the way that I was thinking. And that change in mentality actually allowed me to open up to other options out there. Because believe me, there are options, many options out there. I just think that some of us within the gout community had this preconception that medicine is bad. We might have conspiracy theories. I don't know. Just there are some there triggers, when we say pharmaceutical, it might trigger some people in a negative way. All I can tell you is this: tools can be used for good, they can also be used for bad, right? You see
mm,
it all over the world. Medicine can be used for good.
mm,
I'm living proof of that, my friends.
mm.
I'm living proof of that. So if we can get over the hump, that stigma of taking medicine or being dependent on medicine every day, it's going to go a long way. And that's real. What I'm saying, I'm not, just hyping something up. This is real. And I understand. I'm talking to you as a person living with gout that is in the gout community. I've been through it.
Mm.
I'm actually on the other end of it. I'm in a different chapter of my life. Many of you are still in the first few chapters of just the gout journey, right?
Mm.
And this is a struggle that you'll have to work through for yourself. But if I can add, any encouragement to you, I would just say that we don't have to throw the baby out with the bathwater, right? Medicine is actually can be used for good. And again, I'm living proof of it.
Gary, when Stephanie asked you that, I thought you were going to say, and I'm just going to say it now, that one of the pearls that you picked up along the way is because it took you a long time to get to me, right? As you say, 16 years. But you had
Mhm.
seen many other doctors over time. And so that to me was a teaching point, that it's if you're having a bumpy ride with your gout, with your high blood pressure, with your diabetes, whatever it is, if that doctor or that provider just with their level, their skill set can't get you to a good place, don't feel bad about getting another opinion. Not at all. We all need to have an open mind and go, listen, I value someone else's opinion because I want a good outcome. And I've gone to Dr. Edwards before saying, here's my trouble right now. Can you give me some advice? And we all need that. So take home message. If you're having a bumpy ride, things are not going well, you don't understand why you're not making progress, get another opinion.
Thank you for that. Yeah, absolutely. That is one of our hallmarks, right, at the Gout Support Group of America. And the same thing with Dr. Edwards with the Gout Education Society, where we're all in the game to empower patients and physicians, really, to basically push back on managing gout the right way. There's a right way and there's a wrong way. That's true. I don't think, um, um, there's a wrong way to
Yeah.
manage gout. I'll just say that
Right.
absolutely.
And a
And
plug
if you, yep,
for Dr. Edwards' Gout Education Society is, I mean, this is nationwide. So there's lots of people out there that are not knowledgeable in gout. That's fine. They're knowledgeable in other things. But if you need to find a physician who's knowledgeable in the fundamentals of this illness, the Gout Education Society has a website and a list of doctors geographically oriented so you could find someone in your area to get help. That's really important, right?
Right. Yeah, one of the biggest lessons is this, Chris. If you are not able to advocate for yourself, right? We say this a lot, no one else is going to advocate for you. And that is coming from me, lesson learned from 16 years of trying to get a diagnosis. And trust me, it came from a place of respect too. Like just the way that I was brought up, I am taught to respect my doctors and respect my elders. And so when I go to a doctor's office and they tell me that I don't have something I think I have, and I kind of know, I mean, I'm pretty sure. There's a part of me that don't want to push back, and we're afraid to offend, and we're afraid to be disrespectful. And I'll just have to stop you right there and just say, hey, the most important person is yourself. If you can't advocate for yourself, then you cannot advocate for the people you love. If you're not well, you're not going to be able to love and respect and support the ones you love like they should be respected and loved. Period. And even think of your employers too. Think of, in a very practical way. When I had unmanaged gout and the pain was so real, I would take that pain with me in the car to work, sitting in my cubicle, working, and I would be fighting the demon of pain while I'm trying to do my work. And the employers lose out too. That everyone loses when we're not able to advocate for ourselves. So think of it that way. It starts with you. You're the most important person. And so do whatever you can. Find that voice and speak up.
Thank you both for that. So we know that, it's important to advocate for yourself. And I think part of that is also making sure you make time for yourself via exercise, proper hydration. Dr. Edwards, why are these habits so important, especially for those with gout? And what practical advice can you offer to make these good habits more achievable? I know it's hard for people, even without gout, to maintain good exercise and hydration. So what advice do you have?
Yeah, these are general recommendations to anybody with a chronic, especially a chronic inflammatory process like gout. Hydration is very important. It helps eliminate the uric acid from the body through the urine. So it's actually crucial for that. Um, the you know the biggest part about exercise is that you want to do what you can to get close to an ideal body weight. Um, Doing some exercise a day, and it doesn't take a whole lot to keep your heart in a good place and not deteriorate. A couple of 20-minute little exercise groups going out and walking around the block once or twice a day. You don't have to be out jogging for 5 miles. You don't have to be in the gym pressing, weights. It's just the simple things, but make it part of your daily routine. Stay well hydrated. Those are very important components of staying healthy in general, but especially for a disease like uric acid, where you're trying to maintain a good metabolic environment for yourself and get rid of this disease.
Thank you. And my final question, we've heard, many of you emphasize how gout affects more than just the joints. Would you dive into how gout impacts the entire body? Perhaps, Dr. Edwards just mentioned, exercise and heart health. How does gout impact heart health?
Yeah, it's this is really an area where research has taken off over the last 10 years. We've always known that there is an association between gout and diabetes, gout and hypertension, gout and heart disease and stroke. But what that relationship was wasn't clear. For a long time, it was thought that maybe those diseases also were driven by uric acid elevations. That's probably not true, or it's not the whole story. The whole story is something that was touched on a little bit before, and that's that there's ongoing inflammation. You know, the big inflammation is the flare. That's what people recognize and think all of gout is. But these times between the flares, what we call intercritical periods, the inflammation is going on all the time. And if you do these different laboratory tests that measure inflammation, you can see that they're elevated even, 3, 4, or 5 months after the last flare. And these actually contribute to hardening of the arteries, both in the heart and in the brain. They contribute to high blood pressure. They contribute to kidney disease, chronic kidney disease. So this chronic inflammation seems to be what's kind of driving the relationship between gout and heart disease and stroke at the same time.
Said.
Dr.
Yeah.
Parker, Gary, would you like to add on to that?
No, that was really well said.
Mhm.
I don't think I could really add to that. I'll say that, to my patients, because I'm very simple-minded, I'll just say, listen, if these uric acid crystals can land in and around joints or wherever blood takes them, blood can go anywhere. So you can get these accumulations of uric acid in your kidneys. They can cause kidney stones. You can get them in your heart, literally in the heart vessels, as Dr. Edwards was pointing out. You can get them in the lung. You can get them in the eye. You can get them wherever. And so I use that kind of as a scare tactic for patients who don't want to be proactive, as Gary was saying earlier, and get that uric acid down. I go, listen, it's not just intermittent flares. You're beating yourself up all over the place if you're just letting this thing go. And some people hear me out. Some people they wait. But God will make a believer out of you if you keep getting those flares.
Yes, that's true. With my experience, I would have to say that gout, we have a saying, gout doesn't sit alone, right? And it's really true. And I have to tell you, when gout was unmanaged, my body was really falling apart. I had kidney issues. I had lost 20% of my kidneys. Why? Because I was overusing pain medication and whatnot. My weight was up to, I think, 235 pounds. I'm 5'10". I look healthy now, and because I am, but there was a point where I was 70 plus pounds heavier. I'm barely able to move because just because of the unmanaged gout. That came with high blood pressure.
Mm,
That came with just all kinds of issues. This is real. Again, we're not bringing this up to scare. It's more factual. It's
mm,
just the facts. It's the facts of life.
mm.
If you have gout and it's unmanaged, it's going to happen. You're not only going to have gout. It's you'll probably end up having other comorbidities that will join
Mhm.
the crew, right? And they'll be part of you. But don't feel overwhelmed, because once you're able to manage gout, then it's like taking a bite out of an elephant, one piece at a time. You just take that first step and then that second step. You're going to get better. And as you get better, you're going to be able to do more things. You feel more confident about your life. And the fact that you're not living in pain as much or anymore, like I haven't been in pain since 2010, no attacks since 2010. I was able to reshift my life, get back in the gym, develop a low impact workout for myself that's good for my body,
Mm.
lost all my weight. I'm probably healthier now at 55 than I was, I don't know, at 24, I would say.
In that regard, I
So
got to remind our listeners, if you haven't heard Gary's story before, when he showed up to see me, this guy was in a wheelchair.
yeah, it was
So he was not a
bad.
functional person.
It was
Um,
bad.
yeah, that's how bad it can beat you up.
It was bad. So all that to say that it's imperative that we manage gout in a proactive way, meaning that we do everything we can to target the cause of gout and not just the symptom. So that's the key. And once you're able to do that, I think everything else should slowly fall into line, right?
Fantastic. Well, thank you so much. We are at the end of our hour. I don't think I saw any questions come in, and any questions we had in our Facebook group from the past couple hours, you guys have all addressed. So you must have read their minds. Are there any last words you guys have? Maybe keep it at under a minute.
Yeah. Yeah, I think that it's been mentioned, but when we started the Gout Education Society 20 years ago, it was because of this issue that patients were dissatisfied with the medical care they were getting and wanted to know where there was somebody in the country that or around their neighborhood that would treat it the way that we've been discussing here. And we put together the Gout Specialist Network of physicians that have pledged allegiance to the guidelines, the treatment guidelines that the American College of Rheumatology presents. And we have about 890 physician members of that right now spread across the country, so that if you're looking for a physician that'll take you to the next level of treatment for your gout, that's a place to look.
Amazing.
30
Yeah.
seconds is that will get you the hope that you need. Find a doctor who's knowledgeable and get that help. It's doable.
Yeah, absolutely. And I would say that if you're living with gout, don't lose hope. It's completely doable to have this disease and be pain free. So you don't have to live in fear, right? That's the worst way to live is to wonder when the next attack's gonna be. Like, do I feel that rumbling? What am I going to do if that rumbling comes and the attack comes? What will I do? How will I manage? It doesn't have to be that way. The Gout Support Group in America was started in 2015 to address this, to offer realistic, tangible help um, to the gout community. We want you to know that there is options. There are options out there. If you're living in misery, just know that with the Gout Support Group of America, with the Gout Education Society, you'll be able to find good physicians, good care, good support, good network. You're not alone in this fight, and we're here to walk with you. It's all about the journey, people.
Indeed.
Well, thank you so much. Thank you, Gary, Dr. Edwards, Dr. Parker, and all our viewers today. Thank you for tuning in, and we hope you have a great rest of your evening.
Thank you, Stephanie.
All right. Merry Christmas to all. Huh?
Merry Christmas.
Bye.
Bye.